Hi, my name is Caroline Sprints, and I will be presenting a PechaKucha on my dream job. My dream job is to become a pediatric psychiatric nurse, a role dedicated to both the treatment and support of children facing mental health challenges. This profession involves establishing strong patient relationships, conducting comprehensive assessments, and collaborating with other medical professionals to develop and implement individualized treatment plans. A crucial responsibility of this profession is to conduct regular rounds. Nurses check vitals, administer medications, and assess each child's needs. Through daily one-on-one interactions, they evaluate cognitive and emotional states, reporting any critical changes such as suicidal or homicidal ideations and smaller-scale changes to an interdisciplinary team of medical professionals. Medically, psychiatric nurses are responsible for treating self-harm injuries or injuries related to aggressive behavior. Nurses administer medications and consistently check and adjust dosages in correlation to noticeable changes in behavior. Nurses are responsible for making sure patients are hydrated and fed while performing daily physical and health assessments, including blood pressure, weight, temperature, pulse, and other visible bodily changes. A unique aspect about working in an inpatient clinic is the hours. Typically, nurses will work 3 days a week, which are approximately 12-hour shifts, either the day shift or the night. These come with strengths and weaknesses. A day shift entails more normalcy time-wise, but a lot more activity within the hospital. However, the night shift is more chaotic time-wise, yet the patients are commonly sleeping unless there is a crisis. Effective communication is a key aspect of this role. Nurses collaborate closely with psychiatrists and physicians, creating the most effective treatment plan for patients. Additionally, they maintain ongoing communication with families, keeping loved ones informed about treatment plans, progress, and providing them with essential tools to administer the best possible support from any environment. Specifically, I want to work in an inpatient clinic. In this environment, the unit is highly structured to ensure safety. Patients stay in safe rooms with common areas for group therapy and activity. Nurses in this setting aim to de-escalate crisis scenarios whilst providing medical and emotional support. This environment is typically high-paced and emotionally intense. The entry-level job title of the profession is a registered nurse in a psychiatric pediatric unit. Entry-level salaries begin at approximately $61,000 a year. However, with years of experience, high-paid registered nurses in a pediatric psychiatric unit can make upwards of $200,000 yearly, with a median range of $123,000. In regards to the future, it is important to note that nurses' salaries vary state by state. This is crucial information to know when planning a career. Factors like cost of living, demand for healthcare workers, and state funding all impact the pay. Some states offer higher wages but come with a higher cost of living, while others may pay less but provide better work-life balance. Knowing these differences will assist me in my future life planning. To become a pediatric psychiatric nurse, individuals must have a bachelor's degree in nursing. After completing this degree, individuals then prepare to take the NCLEX RN, an examination to certify individuals into an entry RN title. Once the test is passed, individuals can then begin practicing as a general psych nurse. In May, I will have a bachelor's degree in psychology, making my transition into psych nursing more readily attainable. Since I will have a degree in psychology, my next step is to pursue an accelerated bachelor's of nursing degree. An ABSN program is 16 months for individuals who already have a bachelor's degree in a different major, who prior to graduation want to pursue a nursing career path. This fast-paced program ensures students a degree in nursing while implementing all of the clinical and lecturing experience as a more traditional undergraduate program would. Initially, I will begin with 1 to 2 years of general experience before specializing in a specific unit. This time is dedicated for exploration. However, many pediatric psych nurses complete a variety of certifications to help feel prepared for specializing. Further educating myself on the specificities of both psychiatric and pediatric care will allow me to facilitate strong emotional and medical support. Prior to years of bedside nursing experience, some individuals choose to pursue more education to become a licensed nurse practitioner. This transitions nurses from general to advanced. Benefits include a higher salary, more flexible hours, and more autonomy within decision-making in the field. While this is a long-term goal for me, building a strong foundation in bedside nursing is essential to making this future path a reality. It is important to have strategies to ensure reality within dreams of a future career path. I am certain I want to do my ABSN program in Boston and have been in communication with application advisors from a variety of schools. My goal is to attend next fall, and within completing an application, it is a goal of mine to stay on top of deadlines and make sure I have all of my application requirements organized. Other strategies to ensure success are experience. I have shadowed a wide variety of hospitals in Boston, Michigan, and Connecticut in both emergency departments and ICU units. Gaining hands-on experience and attestment from mentors in this position is beneficial for understanding early before entering this field what I like and dislike about working in healthcare and what role I see myself taking on. Having a background in psychology is another strategy I applied early on when I decided on this career path. Many psychiatric nurses began specializing in psychiatry prior to completing their nursing degree. Gaining this initial knowledge strengthens my future applications by demonstrating a solid foundation and commitment to mental health. Knowing my specialization early on will help me transition more quickly and effectively into the field. The first job I ever had was working as a daycare assistant when I was only 14. From that day on, I knew I wanted to work with kids. Working with kids requires patience, empathy, and strong communication skills. Sources explain that these qualities are essential in working in pediatric healthcare as well. I never knew how I wanted to work with kids until I got older and researched careers and found pediatric psych nursing a career that spoke to me. I knew I wanted to work in a career that would leave me feeling fulfilled every day. In an interview I conducted with a current Quinnipiac University nursing student undergoing psychiatric clinicals, she said, "It's definitely hard. It's sad to see some of the things, but I leave every day feeling like I did something good. Dealing with hardships is minimal to me in comparison to the reward I will feel from doing meaningful work." Sources indicate that many nurses avoid psych nursing, specifically pediatric psych nursing, due to the emotional intensity and unpredictable behavior. For me, this challenge is what makes it meaningful work, aiding support to children and family in need, all while providing compassionate care and assisting those undergoing hardships. The work being unpredictable keeps me engaged, and I am ready to take on these challenges. I have always considered myself to be personable and have strong communication skills. This career works so in tune with other medical professionals that I know I will be able to communicate effectively with coworkers and the families involved. In one-on-ones with children and making daily rounds and reports, remaining calm and consistent is essential with patients, and I am confident I am capable of doing so. Youth mental health is a growing concern, and I am dedicated to raising awareness and providing essential medical support. As an inpatient psychiatric nurse, I will work closely with patients and families offering care, crisis intervention, and guidance. By actively advocating for mental health resources and education, I hope to make a meaningful impact in this field and raise awareness for youth mental health.